So for the next video, we're going to look here at the, as we continue down the central nervous system into the spinal cord. All right, and if you remember, the spinal cord is very important. It's going to have somatic, visceral, afferent, and efferent neurons. All right, and this model is very nice because it shows a color-coded circuit. So you may want to take a minute to actually see how things come in on the afferent and then go out the efferent pathway. And then right here we actually see a split open, a cross-sectioned a portion of the spinal cord. All right, and you can see the white matter here. It actually is colored correctly on this model. The white matter here, and then this kind of greenish color is the gray matter. Okay, so we're going to talk about important features. The gray matter is numbered 5, 6, 7, and 8 right here. And the white matter is numbered 1, 2, 3, 4. All right, there's a lot of other numbers that are also associated with that, but you can tell just from the color difference. All right, so within the gray matter, this part that's actually sticking up here, we have horns, and so that describes the little pointed areas that look like pointed projections of gray matter. All right, and so as we kind of zoom in here, you can see the numbers a little better. 5, 6, and 7. Number 5 is the posterior horn. It's also called the dorsal horn. Either name is fine. 6 is the lateral horn. 7 is the anterior horn or the ventral horn. Okay, so you can call this posterior or dorsal. You can call this anterior or ventral. Both are correct. All right, and then when we look over here at the white matter, all right, numbers 1, 2, and 3, we can kind of define these areas based on how they are in relationship to the horns. So we have the more dorsal area, or the more posterior area, the more lateral area, and the more anterior or ventral area. So number 1 right here, this whole region, right above my finger, is going to be the posterior funiculus, also called the dorsal funiculus. Number 2 here is going to be the lateral funiculus. And number 3 is either going to be called the anterior funiculus or the ventral funiculus. Either anterior, posterior, or ventral dorsal is fine. Both are correct. All right, and then we talk about the central canal. All right, so if you zoom in right here, you can see an arrow pointing to that little hole, number 9. That's the central canal. That's where cerebrospinal fluid actually moves up and down the spine towards the brain. And then we also have the posterior median sulcus, so number 10. You see that little line that's drawn in there, number 10. It's also called the dorsal median sulcus. Remember, a sulcus is smaller than a fissure. A fissure is much deeper. And then you can see on the front side, on the anterior side, we have a fissure. It's much, much deeper, number 14. So it does a good job showing the difference in a sulcus, number 10, and a fissure, number 14. So we call this, back here, number 10. Again, that's the posterior median sulcus. All right, this in the front. Number 14 is the anterior median fissure. You can also call this the ventral median fissure.